Good morning. I'm Dr. Ruth Roberts, your pet's ally. Hope everyone is doing well and you all have a bunch of great questions. And I think Karen has some questions which we may or may not have here in the Facebook group, but let me pop over there first. So I hope you all, I know Jamie got a chance to catch the medicinal mushroom, and we talked about how they can cause a potential allergic reaction. So she's going to check that out by stopping the mushroom product she's got to see if things get better for Willie or not. And Leah, I did talk a little bit about fruiting body and mycelium, and I know there's a lot of people that divvy this out and want to do everything fermented and this and that and the other, but what I found is that taking the whole plant in my research was more effective than any particular plant. So that's kind of what I found. And so the extracts that are in the mycopause are full plant extracts. So I hope that makes sense. I saw this guy walking down the street with these dogs, and everybody was like super chill and having a good time. And Lolly, that's yeah, with the hot water, you guys are your Scotties are not having a good time, I'm sure. Um, yeah, 8 attacks by loose pit bulls. That's just insane. Um, plus bear spray. Holy smokes! If you're a boater, you can get these air horns that will like seriously break your eardrums, and so that may be another thing too to kind of scare them off. I had pups that were traumatized by the boat horns though, so they are pretty loud. Kay is asking about a crusty area around the eye of her 15-year-old Westie. Um, and the vet sort of blew you off a little bit, and then you've got another one around the other eye and the mouth now. And unfortunately, at 15, Demodex is a concern. And so you can get a skin scrape done to see if there's Demodex present or not. Bravecto I would not use, and that's actually an oral chew that's given and works for about 3 months. And then the other thing the other thing that gets used for, or used to be used for um, Demodectic mange was ivermectin at high doses, but the problem is that because ivermectin is a GABA inhibitor and GABA is a neurotransmitter, that can really be a problem as far as creating neurologic issues secondary to the medication. So the other thing we used to use, and I know this because I am old, is Goodwinol. And as you can see, the main ingredient in here is actually rotenone, which is pretty bizarre. So rotenone is a growth producer for plants. The majority of these other ingredients are frankly to smother the mange. So you can check that out. But this is one of the old-fashioned ones. The other thing is that for older dogs that are developing demodectic mange, this generally means that there is immune dysfunction at the level of the skin. And so one of the things you may consider using is immune support by standard process. Let me pop this up for you. And I've used that pretty successfully with some of these older guys. And then you'll definitely want to double up on your probiotics as well. But these are ways that you can approach treating it without creating problems within the gut. But This one is the smaller size, which would be appropriate for a Westie. Hayo's taking this, and for a couple of different reasons, um, but it's, for her, she's 7 pounds, and so she takes 1/8 of a teaspoon. For a Westie-sized dog, I'm guessing it's going to be 1/8 of a teaspoon twice a day. So you can check this out too. Um, but that's going to help support the immune system. You could also consider dermal support, but I think this would be more appropriate. So I hope that makes sense. Let's see, let me pop back over here. Um, and then the other kinds of things are just, skin infection, allergies, rarely autoimmune type diseases, things of this nature. But if this is relatively new and there's something else going on, then Demodex sadly is a good um, option, or a good choice to think about. So the other thing is that if it's not Demodex and you get several negative skin scrapes, it could be a bacterial infection, and then that's where you could use some of the CBD products that our friends at CBD Dog Health make. Let's see, because they've got one for itchy skin, and then also soothe. That's the horse version. So this one, the soothe version, I think probably would be your best bet as far as the CBD products go. So that'll help kind of clean up any infection. And again, because CBD helps to support the immune system function, this is going to help correct it at the level of the skin. So check that out too. Let's see. So I hope that's helpful, Kay. Bettina, this is hard to see. If this opened and drained, it may be some sort of an infection got in there. What I'm a little bit concerned about, I can't tell if this is a raised mass or not, because it's just so dark. What I'm a little concerned about is that if this is a raised mass, this makes me think of things like, unfortunately, mast cell tumor, or histiocytic, I lost the word, histiocytoma. That's the right word. That's a benign version of a mast cell. So if it looks like it had drained fluid, what I would suggest doing is to kind of check it and keep it cleaned up with Epsom salt, things like that. Keep the infection cleaned up. And if you're not seeing any improvement, or if this is indeed a raised mass, I would get it biopsied. Often that can be done just with a skin scrape to make sure that there is not mast cells present. Mast cell tumors are pretty common, unfortunately, in the bully breeds, and especially in Boston Terriers. So we get that checked out if it's raised. If it looks like it's draining stuff, I would do Epsom salts, and then sort of pack it with your favorite topical antimicrobial. So you could use a CBD salve. If you've got some mupirocin, you can use that topically, but really just keeping things clean. Hopefully it will drain out and more do not develop. Hopefully it's just a wound and something got packed in there. So I hope that is helpful. So let me pop back over to the next one. And Bettina, you are just not having a good run of luck with your pups recently. Oh, and I wanted to check in with you to see how, see what Dr. Lisa had suggested about the tissue mineral analysis for Bear. So let me know how that went. And Mr. Handsome Willie, he's hanging in there. So stopping Palladia for now and just seeing what's what, and then reassess in a couple of weeks to see what's going on. So diarrhea is rough. Herbal is on board. Let me check on the questions here. See if we've got that. Maybe that went to my personal email box. Hang on just a minute. Nope, not seeing those here. Jamie, if you're watching, pop those questions into the comments, please. I don't see them, and maybe we didn't get those caught up through, maybe Hannah or Paul didn't get those caught. So at any rate, and let me know how he did with the stopping the mushrooms, if that made a difference or didn't make a difference, because unfortunately, if he's histamining about that, that could be a problem. Let me just check the other email box too. And while that is loading, everything is so slow. Pop back over here. I'll talk about Karen's pup. So new diagnosis of SLO, and interestingly enough, I was talking about this with Catherine and her pup Henry the other day, and thankfully that's probably not what's going on for Henry. But this makes sense as far as things just kind of got worse and worse and worse. So as far on as the options that you've got here, poor sweetie. You know, so with nail trimming, to start with, what I ended up doing with several of these dogs in the office is to actually trim their nails under anesthesia, because we all know it's going to hurt. That way, I would give an intravenous infusion of propofol. They'd go down really fast. We'd cut everything off, remove broken nails that were kind of loose at the level of the nail bed, get the feet flushed up, put a little light bandage on, and they'd walk out the door much happier. Now, in practice, doxycycline and niacinamide is something I did use, because doxycycline seems to have an immunomodulating effect. And I think that in this situation, it is very helpful. What I would use is the microbiome megaspore probiotics along with it, because they have shown that they have efficacy in replacing the microbiome before things kind of go sideways as far as the gut function. So would check that out. If you need help finding anything, always feel free to email Paul or Hannah at the Dr. Ruth Roberts at drruthroberts.com. But so Megaspore probiotics, I would use the doxy and niacinamide because it just seemed to help get things going faster. Now, with the omega-3 fatty acids, this is where I would use a much higher dose and actually consider the 100 milligram per pound dose, which is going to give you a dose of about 2,600 milligrams of omega-3 fatty acids per day. The primrose oil makes sense, the vitamin E makes sense, the biotin makes sense, gelatin makes sense, and then the other thing you could consider too is a collagen product, especially like Dr. Axe's type with the 5 types of collagen in there. Traumeal is fine. I would not add more St. John's wort because it can create photosensitivity and actually kind of worsen some of these things. So I think this gets used quite often, but I think this is not super. Yep. The Welactin, I've not seen. Karen's asking about Nutramax Welactin. I've not seen really good results with this. I think it's very expensive, so I think you're better off buying a good collagen product that's going to help with hair and nails focus. So Great Lakes is a good brand. But again, I would consider Dr. Axe's I think it's called Ancient Nutrition Collagen. We use it personally. We use it for the cats, the cat and the dog. Let me see if I can find it on the site for you. Yeah, here it is, the multi-collagen protein powder. And sorry, my internet is slow. So this is the Ancient Nutrition Collagen Powder. The interesting thing is this is one of the few that I found that includes type 1 and 3, which is for skin and nails, and then type 2 for joints. And then he also includes type 5 and 10, which evidently are part of the scaffolding that's needed to actually use those other 3 types of collagen. So this I would check out. I would give probably start with something like a 1/4 teaspoon and work your way up to a teaspoon per day. I'm going to tell you not to use this though if he has chicken sensitivities, because it does include some chicken protein. If he does have chicken sensitivities, then look for Great Lakes. This is another super high quality product. It's all bovine in origin. So it's, you know, as long as there's no sensitivity to beef, you're golden. We use this one for a long time personally, but what I found is that the Dr. Axe stuff just works substantially better. And we can see it in you know, for ourselves personally, but also for Hayo and Pepe, we see them having better hair. Yeah, and I think that's not an unreasonable thing to do. And then the other thing is, Karen, is that, okay, so now you have this diagnosis of an autoimmune disease. And again, I think this is where we have to really circle back and work on the gut. And so if you're concerned about food sensitivities, you know, work through the things that you're concerned about and remove them from the diet for 3 weeks, and then you can test adding them back in. And then again, you can use the Glacier Peaks test as kind of a great roadmap to help decide what's my pet sensitive to, what's my pet not sensitive to. And so you can check that out as well. Let me see if the email has popped open. Ooh, too many emails here. Here we go. Here's Jamie's email. So, interesting. So liver enzymes are still elevated and gradually going up. It's hard to know how much of that's related to the palladia and how much of it is due to the pred. And this is where, you know, we used to say, oh, the pred only elevates the alkaline phosphatase, but in reality, it can elevate ALT. So if you're gonna go with liposomal glutathione, I would give a teaspoon twice a day, and because that's going to get you to the right dose. And then if you've got a THC combo product with CBD, I think that's okay. So again, the 0.5 milligrams of THC is where you want to start. So if you've got one of each of these, that's great. I would try the indica because this is going to have purportedly more effects as far as the body goes. The CBD dosing, though, is going to be low. So again, you want to shoot for somewhere, for a patient with cancer, somewhere between 35 and 50 milligrams per day. So, I would, see what you've got. If this is a relatively inexpensive way to use the CBD, go for it. If not, then I would consider looking at the CBD dog health products. With the THC, if that's making him feel better, what you might consider is a 0.5 milligram of sativa in the morning, so just shy of 2 drops. That's kind of hard to do. And then a 0.5 milligram of indica in the evening, which will help more with sleep. And you mentioned too that he's getting super itchy, even on the pred. If you haven't, I would try adding in more quercetin, because it sounds like he's getting histamine. He's reacting more with the histamine. And then the other thing is let me know how he did coming off of the mushrooms and see if that improves the itchiness or not. So first step is relieve the symptoms. So quercetin, you could give him 400 to 800 milligrams up to 3 times a day. That's bordering on that dose where we start to worry about the kidneys a little bit, but frankly, I've never seen that clinically. So carry on with that. And then apocaps is a good idea, but I don't think the thought of the product is a good idea, but I don't think that the dosing is appropriate as far as how they work. So I don't know if you ended up starting poly MVA or not. I would consider that, because I think you had mentioned you were going to go for that, but okay, it would be nice to just see the dose of what's in there. But as I remember let's see, here it is. I clicked the wrong one. Yeah, I just don't think that the dosing was appropriate for a lot of these things. And you can't really tell kind of what's what. So I think you're covering most of these items with interesting, for the export, they actually had to spell it out. Lecithin, 50 milligrams, glutamine, taurine, zinc. I think you can do this, whatever you don't have here in your current profile. I think you can work this out. Yeah, interestingly too, they pulled alpha lipoic acid out of this as well, which is fascinating. I think there was a paper that went around saying it was toxic to dogs, although I never saw that clinically. And then they're pulling their beta glucans from oats, which is okay. But this, again, pull your mushroom product, see if that gets the itchiness better. If it doesn't, add it back in. Consider bumping the dose up, or switching to the. But yeah, I mean, I think the rest of this you can do much less expensively. So I hope that helps. And then, yeah, you got it covered. All right, I think that's all of it there. So Jamie, if I missed something, let me know. But Willie is rocking on. And it's good to see too. I mean, he's pulling both of his ears up now. So whatever was going on with that nerve palsy, for lack of a better description, seems to have resolved. Okay, Karen, we got that. Let me spin this up to make sure I haven't missed anything and check my cheat sheet. I think we got everything. I'll just double check here. Yep, all right, we got it. That's what I've got for you this week. As I said, we'll be talking about pica in pets for our next iPets Ultimate, and that will be, oh, come on, I think that is on the 28th. And then I'm going to do some information about the omega-3 stuff coming up on the 28th as well. And we'll go from there. So until next Monday, you all have a wonderful week. Let's see. So yeah, so the 28th, that's going to be the iPets Ally will be at 5 p.m. And that's Central Time. And Karen, the standard process is going to be available now. Actually, they've started shipping it. They're getting caught up on pre-orders, but my rep was telling me that that should be flying out the doors here pretty quick. So, rock it out, go for it. But you definitely, if you're looking at an autoimmune disease, you definitely want to use a much higher dose. So in the order of 100 milligrams per pound, as we discussed. All right, you all take good care until next week, and give everybody a hug for me. Thanks.